Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Mario, tell me what's going on with your knee. What happened?
Well, the thing is, I've been in therapy with in Kaiser pregnancy.
Okay.
The thing is, I cannot bend it more than 90 degrees.
So when did you have surgery? You had a total knee replacement, so we can see it here.
In May the 3rd.
May the 3rd this year, so it's about 7 weeks now.
Almost 7 weeks.
So you had physical therapy treatment for 7 weeks.
Yes.
Can you give me an update about what do you feel? What kind of pain? What's restrict you now?
Well, the thing is, when I see my orthopedic doctor 3 weeks after the surgery, this pain just on the right side of my knee is starting so so painful, but since I haven't stopped, that's one of the things. I cannot do much, exercise to bending.
How much pain from 0 to 10? 10 is emergency room.
They say 10.
10.
Yeah.
So what's difficult for you to do because of your pain? You have hard time to bend your knee?
Yes, that's exactly, yes, I have time.
Okay. Show me where do you feel the pain now?
It's like this right here, this
Okay,
over here.
let's bend your knee and let's see how you feel.
No,
And straight.
It's kind of unbelievable pain right here.
0 to 10, how much?
It's like from 1 to 10 is 10.
10. Okay, let's take it easy. Okay, I will take your range of motion and we'll do the treatment after that.
Okay, perfect. It's okay, this one right here?
Yeah, that's fine. Okay, so let's bend your knee. Let me see how much you can get. Bend it.
You can push it if you want.
No, we want to bend it like the comfortable level you have.
Okay.
So as you see here, it's like 80. 1 second. 1 second. Here you go. Here you go. It's 80 degrees here. 80 degrees. So how many weeks of physical therapy you had so far? Before coming here?
Probably, let's say first.
Let's take it again. Oops, sorry. So it's 20 degree flexion. 20 degrees.
Extension.
Minus 20 degrees extension. And the flexion 80 degrees. Okay, bend your knees. So you feel most of your pain on that outside here, yeah?
Yes, that's definitely true.
Make sure what I'm doing is not painful, okay?
Well, you know one thing, doctor. Do what you had to do, had to handle.
No, we don't want to cause pain. If you feel pain, that might cause damage to the healthy tissue. It will interfere with healing. We don't want to cause pain, okay? There's fine line between losing tightness and causing damage.
Oh, I see.
And if the patient feel pain with the treatment, there is high chance that treatment causing damage and actually causing more harm than benefit.
But the one thing is, I have a friends, they have the same surgery. This almost one of them 2 weeks before. 2 weeks I got mine.
Okay.
And then, but like I said, they had their knee. It was fine when they got the surgery, like me.
Okay.
If I got my, I don't have nothing in my knee before. At this time I was better.
Oh, okay.
Because this problem in the right side, I don't see nothing to do with this. I mean, maybe with the trauma, the surgery. So that's why it came out again. But
yeah. So can you give us a little bit history about your knee? You have a little scar to the left and right here. What's happened?
That's like I said. I was a football soccer player. One of the other guy hit me so badly.
Okay.
And my knee remains stiff. And then when the doctor saw me, all he did, I don't know what kind of injection put me right there. the bone.
They inject you?
Yeah.
Inject your knee? That's before you had the total knee?
Yes.
Okay.
But it's 43 years ago.
43 years ago, okay.
Yeah. I was 25 years old.
Okay. And that's what about the scar, left and right? What happened? Is that a surgery?
Yes, that's the surgery malpractice. They gave it to me in that time.
This scar here and scar here. Can you
Yes,
see
almost
that?
a year
That's an old
after.
surgery. That's 32 years ago or 35, you said?
Yes.
Okay. Make sure what I'm doing is not painful, okay?
Okay.
And relax. Okay. Relax, relax, relax. It's gonna feel cold, okay?
It's okay. See, most of the time, doctor is coming with try to bend it. That's,
Yes.
That's
You
all.
feel that scar tissue here? You feel this bump?
Yeah.
That's a scar tissue.
Oh, I see. See, I got a bunch of them.
Is that painful?
No,
Really?
it just like a numb when you go through to the scar.
This
scar.
that's numb here, and you
Yeah.
feel this one here. Make sure that's not painful. All right. So think about pain like a check engine signal in your car. Okay.
Okay.
So if you have a check engine signal in your car, there's two options. One is cover the signal and keep driving and hope for the best. Two, fix the problem and the check engine signal will disappear. So if we follow the model of no pain, no gain mentality, it's similar to covering the check engine signal and keep driving. And there's no guarantee that will how much damage that will cause if it's caused damage.
Yeah, what I understand you is like if you got that check engine signal, that means you have to see what's going on with your.
We have to figure out to fix the problem, and instead of doing exercises that pushing the pain, that causing more damage. So if you have a micro tear and you push the pain, that could lead to major tear.
I'm agree.
That's why I disagree with that philosophy, and unfortunately, a lot of health care providers follow the approach no pain, no gain, and that might cause more harm for a patient than benefit. You know.
Yeah.
Sorry. Here, is that painful?
Yeah.
You're very okay. What about here?
Well, it's pain, but I'm not. It's
Is this painful here?
I tell you what. A long time ago, I have a sciatic nerve problem.
You had what?
Sciatic.
Sciatica.
Exactly. Sciatic.
Sciatica. Okay.
Sciatic. And then I have a bunch of nerves, all the way from here,
Okay.
all the way down there because I cannot walk that time.
Okay. You feel that scar tissue here? You
Yes,
feel this bump?
Yeah, I can feel it.
It's a lot of scar tissue, and you can see the redness here actually. You see, and you look at the instrument. It's just moving over the scar tissue. Sorry. And he has a lot of scar tissue here that's pulling on the knee. Okay. Are you comfortable lying on your side?
Yeah. Yeah.
Okay. Lie on the other side.
Yeah, I can feel a bunch of like a
Knots.
balls.
Yeah, that's the scar tissue. You have a lot of it. Did anyone work on the scar tissue?
No,
You said you had physical therapy for here.
no, they don't do nothing like that. They just put you to do,
Exercises?
Yeah.
Exercises does not break scar tissue. You feel that scar tissue?
Yes, I do, sir.
Okay, is that painful or it's okay?
It's kind of painful, but
Make sure you tell me if okay.
No, it's hurt, but not.
If you feel pressure, it's fine. If it's painful, no.
No. It's fine. I mean, I can see like a balls inside.
Yeah, and here. Too much?
No, it's okay.
Okay. And you can see the instrument here just rolling. Look at this.
Yeah, I can feel,
Yeah.
like a.
Yeah.
It's like a, let's say.
It's like a going that this. I'm just exaggerating, but this is what happened. Look here. Look. You see the bumping? That's a scar tissue. This is a proof of the scar tissue. It should not be bumpy like this.
It's just like a street with bump,
Yeah.
In order the car
And here
don't
too. Here.
Then the car don't.
You see? It's
speed.
like a gears going gears, not smooth. Compared to nothing here. You see how nice and smooth going.
Right there
And
is
he
not
has a
much.
Here
Right
there's
there,
a scar
I feel it.
tissue. It's bumpy. So you get a lot of scar tissue. Too much?
That's okay.
Okay. Sure, I made a mess here.
No.
Lotion everywhere. Everywhere.
No, see, it's hurt, but not like when I bend it.
Okay, let me clean this. Okay, let's lie on your back. No, your back. This way.
Oh, I'm sorry.
Okay, so you get lotion everywhere here. That's when you know you get treatment. You have lotion in your clothes. Alright, okay, so let's bend your knee and tell me how does it feel. Any difference? How does it feel?
It's like well, not I have pain, but
Okay. So now it's 88. It was 80 degrees. Let me work on it more and see if we can get more range of motion. Where do you feel the tightness when you are bending?
it's like like a bendy like that. It's like I say hurt, but I'm not like you did at first.
Mm-hmm. Did you feel pain when we bended the second time?
Well, the second time not much like the first.
The first time that was 10 out of 10. Okay.
Yeah.
So I'm gonna do a couple of things here. We'll see if we can get more range of motion.
That's just like a peach.
Yeah. That's as long as you don't feel pain, bend a little bit. You can just hold it here. Hold it here. That's tight. Oh man. This. Too much or it's okay?
It's okay.
You feel the tightness, that band here?
Yeah.
You feel that band?
Yeah.
That's a lot of tightness here.
It's so many years,
Yeah.
and nothing I can do about it. And because, like I said, those man, I don't want to say it, but
Mm-hmm.
you know better than them.
Is it painful? Sorry.
That's okay. That's okay.
Alright. Okay, stretch your legs
Straight.
and bend it again. Let's see how much. How that feel?
It's pain, but I'm not.
It's 90 degrees now. 90 degrees, 10 degrees. Do you still feel pain?
Yes.
How much from 0 to 10 do you feel it?
It's when I do it like that, but it's the same. It's the like I said. It's the pain. right here.
In this spot.
Okay, you know, like when you bend it right here,
Yeah.
I know it's pain, but inside my knee, but the most bothering is that's a little bump.
Yep. Okay, so you just gained 10 degrees now. Okay, we're gonna do the extension again, but I'm gonna do the extension now. Make sure it's not painful what I'm doing, okay?
Okay.
Any pain with that?
No. No, nothing pain at all.
You have a lot of scar tissue there. That's gonna take us several sessions to break it, okay?
Okay.
It's a lot of tightness. Yeah, I feel that. Bend a little bit. Relax. Go
Okay.
down. So the extension was minus 20. Okay, I'm gonna take the extension. Okay, that's a straight and bend. Bend again. All the way. Okay. So that's still 90 degrees. 90 degrees flexion. Okay, we're gonna do the extension straight. That was minus 20. Let's see now. Now is minus 15.
We gave
15. So you gained 5 degrees extension and 10 degrees flexion. Let's sit up for me.
Pardon?
Sit up. Okay. All right. How you feel? Let's bend your knee and tell me how that feel. Can you tell a difference?
Yes, it does.
The first time you bended, you were like, your face shows a lot of pain. Do you feel pain now?
I mean, here not much.
Can you feel the difference in the movement?
Yes,
What's the difference?
much better than when I start before to start.
Yeah, you were like almost stuck the first time you were bending. Now you're going back and forth.
Yeah,
Yeah, that's awesome. So what do you think about ASTR treatment?
pretty good.
Yeah.
That's what I'm here for with you because I mean, when I saw the first time that, like I said, the video is that's what I need because that's different treatment.
Yeah.
They've been given to me in the Kaiser is not even close what you just gave it to me.
Yeah, I'm glad you're doing better. Yeah.
And that's why I'm see you next Wednesday, I hope.
Yeah, awesome. Thank you so much.
Okay, yeah, see you. So I feel better.
Yeah, looks good. Look at this. Are you trying to show off now? That looks good. Yeah, we're gonna do more exercises after this.
Okay.
Right, that's look beautiful actually. I like your range of motion now. It was 80 degrees, now it's 90 degrees, so able to bend. Beautiful.
Like I said, you know, at least gain some more.
Yeah.
I'm happy with that.
Yeah, I'm happy too.
Yeah.
Yeah, awesome. Thank you.
Thank you too.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.